Hi, I'm Liz Lundry, the Clinical Education Manager for StellaLife. Thank you for joining us for our Innovator Series today. We know that some of you are opening your dental practices, and as you're doing that, you're facing many challenges. So today we're going to be hearing from Dr. Ravichandra Juluri, a periodontist and oral implantologist in Dunlap, Illinois, who has kept his office open since day one of the pandemic to treat emergency patients to reduce the burden for the ERs that are in his community. So he's going to be sharing with us how he's dealing with the issues all of us are facing right now as we return to our practices. Dr. Juluri completed dental school in India and came to the US in 2002. He has his master's in oral biology and did his residency at Temple University Dental School. He was the director of implantology at Mahari Dental School in Nashville from 2008 to 2012. And he's currently in private practice and adjunct faculty at the General Practice Residency Program at St. Francis Medical Center in Peoria. He served as a delegate for the ADA and the Illinois Dental Society. He also designs instruments and has authored implant research articles and case reports. So let's hear from this wonderful innovator, and let's welcome Dr. Juluri.
Thank you, Liz. Thanks for introducing me, and thank you, StellaLife, for inviting me to speak. I'm Ravi Juluri. I'm a periodontist and practicing in Peoria. I'm 2.5 hours south of Chicago. And when StellaLife approached me to present and talk about my experience during COVID times. So I've been treating patients for dental emergencies, and like you've seen, like a lot of states, there have been restricting dentists, and a lot of businesses are closed due to the shutdown. So same way, like even in Illinois, a lot of practices are closed because of COVID. So we've seen like a lot of patients calling and asking about treatment. So we decided to have our office open just for dental emergencies. So the reason we did that is it's going to help out the community, and patients, they don't have to be in pain till the dentist opens the practice. And also it would take the load out of the hospital emergency rooms. So we have even few other specialists in town, oral surgeons, endodontists, and other periodontists in town. We have our offices open, and basically we're treating emergencies. And so what's different than before? It's now in practice, it's basically I'm doing emergency care. Mostly it's been extractions and treat like patients with a fractured tooth or a broken filling or anything, try to get them out of pain and do the treatment, and then refer them back to their general dentist. We're not doing it to get more patients or make more money or stuff like that. So it's mostly to help out the community and take care of patients. And any patients that come to us, basically we're treating them and sending them back to their dentist, or if they have any other problems, they can still reach out. And patients have a challenge. Patients, they're facing a challenge because a lot of offices are closed, and not every office has remote answering facility, or some of them are not equipped to handle emergencies. And even when I treat the patients, I'm seeing, and I mention what all is needed, and I send them back. I'm still diagnosing everything and letting them know what's needed. And the challenges we're facing now is, the main challenge is like the PPE. I still don't have any N95 masks. So even the 1 or 2 that I got, they're done. I've used it a lot, so you can't use it anymore. So I made a video to show, because some of my friends and my wife, they've been talking about how people are converting the regular surgical masks to make it fit better and have a tight fit. So I made a video and I posted it on YouTube. I'm Dr. Ravi Juluri. I'm a periodontist, and I routinely use surgical masks But what I found is we don't have a proper seal with the surgical mask on the sides, especially in this area. So I just want to make a video and show you guys how to get a better seal out of a regular surgical mask. So it's going to end up be like this. So what you have to do is take the mask and make a knot on the edge. Same knots on both the sides. It doesn't take too long, it's really quick, so you're not going to spend too much time between patients, or you don't need much planning for it. So just make a loop like this, and after that just push this part in so it ends up being like this. Okay. And both the sides, and so it's a regular surgical mask that you can convert it and you can get a good seal on the sides. It's more sealed on the sides, and you get a better seal on the bottom around your neck also. And you don't have much learning curve because we are all used to the surgical masks. Thank you. So I've been using StellaLife for almost like 3.5 to 4 years now. How I started was I was asked to evaluate the product, and I kept the product aside. I didn't use it for some time, and I started on a patient who always has a lot of pain. So 2 weeks after that, she came back, said, "This is the first time I don't have any pain," and I've been using it since then. I recommend it to every patient. And so during the COVID time, I've been recommending it even more, and my opioid prescriptions have gone down a lot. And during COVID, initially they were saying NSAIDs can increase your chances for getting the disease or having complications. So that's the reason I stopped. I restricted the prescriptions for NSAIDs also. So instead of asking them to take the larger dose, I've been asking them to take 200 milligrams, and if needed, a Tylenol in between. But to strictly stay with StellaLife Vega Gel, and most of my patients haven't complained, so it's doing its job. So while treating emergencies, there are things like it's different than before, because earlier I used to have a treatment plan and have everything planned out before I start the treatment. Now I get a patient, like last week I saw a patient that came in and I had to do an extraction, and the patient didn't want to come in too many times. Then I said, if we have to replace and have a permanent option, then the option is to do an implant now. And the patient said, okay, let's go ahead and do the implant. So I extracted the tooth and placed an implant and placed a healing abutment and bonded the tooth to the edge, the fractured tooth and adjacent teeth. So in that way, that's limited the number of visits the patient will be coming to the office. So instead of her coming extraction and then again come back again for a radiograph to check the bone healing, and then place an implant and a healing abutment. Instead, I placed an immediate implant healing abutment. The patient was happy. So the next time I'll be seeing her is for suture removal and another radiograph to check the healing in 5 months, 4 to 5 months, and then send the patient to her general dentist. So there are things that have changed. Definitely, we have to be prepared to change the treatment or stop the treatment. So the main thing is we are trying to do is limit the patient visits, because we don't want to use up all the PPE that we have just for post-ops. And also we're telling the patients to give us a call if they're in pain beyond 1 to 2 weeks. And most of them, they don't have any issues. Like 90%, they don't have any problems. So they'll be going back to their dentist for further care. And the updates or changes to the practice, we are restricting the number of people that can wait in the waiting rooms. So we have the patients call us and then come in, and we make sure they go in straight to the treatment rooms. We don't have anyone waiting in the waiting area, and there's a lot of cleanup. We had to change the furniture in the office, get rid of the comfortable sofas and all, and put like regular chairs that can be cleaned easily. And the seating position had to be changed to accommodate social distancing. And again, what I'll be like someone asked me for advice, what I'll do different. I'll be doing the same thing, but only thing with extra precautions and extra PPEs, and that's going to add to the cost of the treatment, cost of the expenditure in the office. So we had to buy additional stuff, and there's still a lot of unknowns. We don't know. There's a lot of discussion about who's going to pay for it, whether the insurance is paying, or do we add on the cost to the patients. So for now, we're not adding the cost to the patient or billing out insurance, but we have to come up with something as a profession. Something has to happen. So now, with the extra time I have now, I'm working on some instrument design. So earlier I developed a curettes for soft tissue surgery. So now for periodontal plastic surgery, now I'm working on the insertion tool to get better access to put in the graft tissue and all. So there are a lot of things that I'm trying to work on, and I'm sure every dentist, they'll be planning on getting back to work. So I'm just waiting to get back to work and get back to normal dentistry again. During this time, I've been working on some case reports, cases that I always wanted to publish. So I'm working on those to publish those, and spending some more time with family. And that's it. So that's all I have for today. And thank you, Liz, for giving me an opportunity to speak. Thank you.
Thank you, Dr. Juluri. We really appreciate hearing about your experience. Now, we at StellaLife really want to support all of you as you're returning to your businesses, and we want to send you new patients. So please contact us so we can tell you all about how we can do that. And join us again next Friday at 12 Pacific, 3 o'clock Eastern for our next installment of the Innovators series to get some encouragement and to learn something new. Please stay safe and healthy and have a wonderful week. Thank you so much.